I usually say that abortion care is health care. So by not considering the provision of such care, you are actually denying people their right to health care. Though most people look at abortion as a filthy act, as something that's just done by people in society. No, but we need to start looking at abortion as health care. And we need to remind ourselves that by denying the women or the couples who choose to end a pregnancy for certain reasons, we are denying them their right to health care. So if we move with that agenda, we shall be able to really make considerations fronting the health of the people, not fronting the morality of that comes with a pregnancy and keeping it to term, regardless of the outcomes of that pregnancy. And finally, the parents, they have absconded from their work, and it's time that they came back. They talked to those young people. Then they also talked to each other, like as parents at home, talking to each other about the young people they have in the home and how they are going to be able to talk to them. If they cannot talk to them, then they need to find resources to talk to them, to get them the conversations. Some of these happen or are available in some communities. They have youth centers where they can get appropriate information.
This is the Policy Digest, a Center for Policy Analysis podcast that explores how African societies are governed and how people and their leaders are shaping the future of their communities. Through candid conversations and insightful analysis, we aim to provide a deeper understanding of the political, economic, and social landscape of Africa. So sit back, relax, and get ready to explore the diverse and dynamic world of African governance.
Welcome to today's episode of the Policy Digest, where we dive into deep, key legislative and policy issues shaping our continent. I'm your host, Faith, and today we're exploring a topic that's essential as it is sensitive: sexual and reproductive health policies in Uganda, with an emphasis on policy and legislation around abortion. With us is Charles Katulamu, a researcher and doctoral candidate in sociology at the University of Michigan. Charles's work explores fertility, behavior, access to healthcare, gender, and family dynamics, especially in urban Uganda. Charles, welcome to the show.
Thank you, Faith.
Yes. Please tell us about yourself, Charles.
I am a doctoral candidate, majoring in social demography and sociology at the University of Michigan. My work largely centers around global health issues with a specificity in sexual reproductive health, maternal health, and HIV/AIDS. I am as well a non-residential researcher with the Population and Social Development Institute in Uganda, where we work or we focus on how we can center the population in the policy of many African countries.
Okay. Thank you. Thank you very much. Okay, before we get into the topic of today, I want to run a temperature check. So I came across a video where someone was curious about a certain subject, and then they also, shared their curiosity. And they were talking about menstrual cycles, specifically in WNBA, Women's National Basketball Association, for those that might not know. And they said that because our menstrual cycles last a certain period of days, there are sometimes when players tend to play when they are undergoing a menstrual cycle. And we know that these cycles have both a physical and emotional symptoms.
Right.
And it's been found that certain players tend to play better whilst they're on their menstrual cycles, while others tend to play a little less. So certain people have used that in defense strategies. So the question I have for you is, would it be ethical to track the opponent's cycle for team success, the same way that they track the players' cycles?
So definitely would be unethical to do that. I feel, yes, there are statistics and everything, and I think when they are preparing for games, they run over those statistics, for the opponent's statistics, and they even watch their games to prepare for them, right? The different opponents.
Yeah.
But I feel like definitely tracking the menstruation cycles for players from the opponent sides is really very unethical and going to someone's privacy. And I believe definitely that even if it was to say that they would ask for consent, definitely a player may not wish to be tracked by the other.
Definitely.
But I think actually, I mean, now you bring it up, it may be actually something that teams may be doing behind the backs of their opponents, and by the fact that there is data that can show how a player performs when they are on or when they are not on their periods, then they may be doing it behind their backs.
Yeah, definitely. When I was considering it, I thought, that would be an interesting strategy. Then I thought of it being done to me. There's someone out there that knows when Faith is. It's quite unethical. Before I give a brief synopsis on our topic of discussion today, I know a lot of times we tend to get technical with terms, especially around policy and legislature. So is there a way in which you can break down what you do in the simplest way possible before we get into it?
Yeah, so before I got into what I am in now, that's about several years ago, around 2014-15, before I got into my first degree. My intention was about society and the people. So it was about how I can impact a life and make an effect that even when I am not around, someone would look back and say that because of this person, I am who I am. So then I chose two areas, health and education. Yeah. And because those were, for me, they were pertinent in how we live our social life, and they were key social services to the people. So, of course, over time, the objectives and the specificity as went on narrowing down. Yeah. And so what I would say that I care so much now about women's health, and I care so much about women's health that is mostly associated with birthing or giving birth or having children. Yeah. So that entire process of getting pregnant or having sex, and then you get pregnant, and then you start caring for that pregnancy to term, or you choose somewhere to have it out and not keep it to term. Yeah. Or not giving a baby out of it, or not getting a baby out of it. And its related well-being of women is what I mostly care about. So that's why you would hear things like fertility behaviors, looking at how women think about their having babies or their partners and their pregnancies. Things like abortion, when a pregnancy gets out or is terminated or is stopped from growing into a baby, as well as the maternal health, when a woman decides to give birth, that well-being, that health, either antenatal-wise, during the pregnancy, postnatal, after, and the outcomes of the babies they give birth to. That child health, the child health element of it. So that's what I care about. So I like talking to people, learn their stories, learn their experiences, how they have navigated those areas of, say, having sex, talk about the experiences keeping a pregnancy or removing a pregnancy, talking about the experiences giving birth, where they went, how they thought about the care they wanted to get. So that's what I mostly do. And then I use those stories to think about how do we then better the lives of the people. So I use some people's a sample of them, like part of the people, and I get to understand what they went through. Then I think through it and suggest better ways we can work to improve.
Yeah.
For others and also for them, because they're still alive and all that. So that's where we now start talking about policy analysis, informing policies and all that, evaluations. Yeah, but it's about, because I've sat down with these people, learned about their lives and what they have gone through, then thought through those stories to think about, okay, if this happened in this way, then how do we improve this area? And then who is the right person to be talking about? Now that's when stakeholders come into play, right? So if it's now health, Minister of Health, Minister of Gender have to come into play. The Minister of Finance, because again, financing the perspectives or the elements of health. Yes. So that's what I basically do.
I like the fact that you take time to understand their stories, because now you are aware when you're going through the process that there's people at the end of this and there's more fight behind your...
Right.
Yeah. So we know that sexual and reproductive health, or SRH, is recognized globally as a human rights and public health priority. Yeah. However, in Uganda, SRH policies are often met with tension, cultural debate, and legislative ambiguity, specifically in the context of abortion. We see that Uganda's law on abortion prohibits several acts and omissions relating to abortion. So I'd like you to expound on what the law says about abortion. But before diving into what the law says around it, I'm curious to know, in your opinion, what are some of the most common misconceptions people have around abortion?
So I think the most common misconception, both around within the population, with the general people, the general masses, and also actually surprisingly, the health workers, is about whether abortion is allowed or not allowed in Uganda. Yeah. So commonly, the phrase you'll hear from people is that abortion is illegal, that it is not allowed. Yeah. That's not true. So abortion in Uganda is restricted. Yeah. But there are circumstances under which it is allowed. But the general conclusion that the masses have gone with, and also most health workers, is that it is illegal. It's not allowed. Yeah. And unfortunately, even some circumstances under which it is allowed, some health workers do not know that those circumstances, under those circumstances, abortion is allowed. Yeah. And some even may know, have been affected by their personal attitudes, that they do not agree with the policy. So they're saying, yes, I know it is allowed under that circumstance, but for me, I don't agree with that position. So again, that's their personal opinion. Yes. But I think using it in providing care as you're mandated is problematic. If you're saying, yes, I know it's allowed, for instance, that if a young girl is raped, and we know they're in school, the rape was not, of course, something they called for. And they prefer, as a person, as an individual, they would prefer to terminate this pregnancy. Yeah. And as a health worker, you're saying that, I know, yes, the circumstance you're suggesting, you are allowed to terminate, but I wouldn't. I don't agree with it. Yeah. I would rather advise you to keep it. Then you're going against that woman's or that young girl's right to have a choice of our body, which choice is also protected by the policy, by the health policy, because for that circumstance, at least the police allows for abortion. So that's the common misconception of saying abortion is illegal, is not allowed. Yeah, it's only restricted. And for some of us, we say it's highly restricted in Uganda, but it's not that it's illegal. Yeah.
Okay, I understand.
But getting back to the law, so Uganda's abortion frameworks or legal ground stems from as far as 1950 under the colonial government. Yeah. When the Penal Code Act was passed. So we had three provisions. Well, we have three provisions because that particular Penal Code Act is still active. Yes. Where one is not allowed to terminate a pregnancy. And if they terminated, or someone assisted to terminate, they would go to prison for 14 years. Yeah. And the other provisions about providing any agents that can aid a woman to terminate. And that would take it 7 years, as well as one who procure, as well as a woman procure an abortion. It would also, they would also go for 7 years. So of course, after that, the passing of the Penal Code Act, we went into a series of other law makings. But until 1995, when we had the promulgated constitution, that's when the issue came up again. And the article, I think 22, suggests that 22.2 suggests that either 22.2 or 22.103 suggests that you are not allowed to terminate a pregnancy unless accepted by law.
Yes.
And it stops at that. Now, we're unsure whether the law it was referring to in the Constitution is that of the Penal Code Act or some other law that we do not know.
That we don't.
Yeah. And until 2006, we had nothing else that adds on any substance about what is the law saying, who can terminate. So the Ministry of Health released or launched the maternal and sexual reproductive health standard guidelines, which include that for abortion, if a woman, if a pregnancy is threatening a woman's life, or if the growing fetus is injured or it's abnormal, if a woman is raped, if a girl is defiled, if a woman is HIV positive, and in cases of incest, you can be able to terminate a pregnancy. But for all other reasons, maybe, because I'm in school, I need to complete this degree, I think I wanted 3 children, now I don't want the 4th one, so you cannot, or you are not allowed to. It's not provided for. But that's just in the policy, again, that's just under the standard guidelines of the Ministry of Health. And the other thing they add on in the guidelines is post-abortion care. So you can get post-abortion care. So regardless of how you terminated the pregnancy, whether it was one that is provided for within the policy, or it's one that you decided at your own individual discretion with your health service provider, or even yourself, because they are abortions that are self-managed. You can still get post-abortion care from even public health facilities, which comes at no cost. And from the research I've done, I found many women and girls that have benefited from the provision of post-abortion care, because sometimes these pregnancies are out without being triggered. So that's what you'd call normal abortion or natural abortion, or usually referred to as miscarriages. Because a miscarriage is also an abortion, but it's one that has not been triggered, one that has not been directly engaged by a health worker or yourself to remove it. So until the 2006 standard guidelines are what you may call as the most recent policy or regulation that really works around abortion. So that's where we stand as a country, and that's why sometimes we say it's blurred, it's ambiguous, because even when they exist like that, there is still some very much unclarity about where to go, how to do it, whether even the person or the health worker will be able to say, okay, I agree with you, this pregnancy is out of an incest because the brother and the sister slept together and they had sex and got this pregnancy. But someone may suggest that, okay, how do I acknowledge that this is a brother and a sister who slept together?
I was going to ask about that, and how
So someone may say, I won't, because I cannot prove that you are a brother and a sister. Because again, if they find out otherwise, that they do not fall under that category, probably the health worker may face legal repercussions. So that's another thing that may affect access.
I understand. I was definitely going to ask, because I can go to a hospital and say this happened to me. Are there any, what strategies do they use to find out whether this has actually happened or not? So from your research and fieldwork, why do you think the topic around abortion remains such a heated and politicized issue in Uganda?
There are about, I think, 4 strands. One would lump it up in and say culture, but you'd say the norms, the morals and values that we kind of want to live with. So people believe or think that you can't get pregnant, and the next day you think about terminating. What did you think about when you got the pregnancy? And others of course definitely think that it is morally disrespectful that for you can get pregnant and you just decide that you're going to terminate that pregnancy. So it has a very huge moral stand. Then religion, which is still attached to morals and values and all that. So religion as well has a huge impact, and it carries a lot of weight around the issue. Then the legislation, which definitely the legislation is shaped by the morals, by the culture, by the religion, because legislation at the end of the day are opinions of what is coming from society. So the same people who are in society today are the ones who are representing in legislation. So definitely, if we have a heavy moral stand in society, it is a representation, it's a reflection in say, the parliament or the policymakers. Right? And of course, the other trigger now is education. And you would call it education plus, maybe women emancipation. So of course, today there are women who believe it's my body, it's my decision to get pregnant. It's my decision to think somewhere in the middle of the way that I don't think I need to carry this pregnancy to term. So that those four strands really place a lot of weight on the issue. And given the dynamics around them, you realize that either you can have the legislation proceed successfully about the issue or actually be deterred, because if there is a high moral ground, there is a high religious interests, high cultural interests, and of course those pin towards the legislation. They kind of like hinder the progress of legislation around abortion. But if women emancipation, women's rights or couples' rights, education and others kind of like overturn and flip the coin, and people now start to think differently, then definitely there will be progress around the issue. So the stigma, so all those four strands now lead into stigma. Now the stigma around the issue is really, really a huge stake that has regressively impacted legislation and policy making around the issue.
Okay. Earlier you had mentioned the guidelines under which people use. So I was just wondering, what kinds of consequences, like, is it possible to break down the kinds of consequences, whether health related or social, that ordinary Ugandans face under the current policy environment, especially women and marginalized communities? So it can be both on the side of the person that's probably seeking the abortion, but also maybe family and then health workers as well.
So the most is stigma. That cuts across from the individual themselves, because even women, I've talked to women who have terminated their pregnancies. Even those who have went ahead and terminated their pregnancies, you find them time later questioning whether it was the right thing to do. So even women themselves, the individuals, that stigma still kind of like runs around them over time. Then of course the society, family, the stigma is heavy in the health sector. So stigma is a very big consequence of the current policy and legislative ground around abortion. Then the other thing is access to the service. So definitely because of the nature of who is supposed to get the care, who cannot get the care, is definitely simply because of so that leads us into discussing the access issue. So who can access, who cannot access. Yes, the policy, for example, guides that a woman who has a pregnancy out of incest, rape, defilement, can get fetal injury. If the pregnancy threatens the life of the mother, can get an abortion. Now the question then becomes to, where can I go? So if you go to hospital, then I think there's a point of like, you need to prove a point. Are you under those categories? And if you do, for a situation like, if it's threatening your life, definitely a health worker would be able to diagnose that, would be able to observe that, and they can guide. They can say, okay, if you think like this, but maybe you can be able to maintain this pregnancy if we did this and this. Or the situation is alarming, we really need to terminate this pregnancy. But now circumstances that are socially driven, like incest.
Yeah.
So I think there you'll need a DNA approval.
Definitely.
Which means money, which means sometimes the woman doesn't even have this money, or the couple doesn't have that money.
Yes.
Then rape, sometimes with rape, some women fail to get the courage to come out early enough.
Yeah.
Which is not their problem. It's a problem it's a resultant of what they went through, the trauma. Now, given that, you find that they may take longer to even make a decision.
Yes.
Because first of all, they're scared of like, okay, how do I even start explaining what I went through? So later on, when maybe they get the courage to say, now I want to terminate this pregnancy, they may ask them whether they did report this issue.
Yes.
So if you only ask and you don't actually provide some care, guidance on how this woman should go about it, maybe get the file in with the police and come back and access the abortion they want, then you'll find that they will just be turned away.
Yeah.
Then defilement, similar things, because now to get for defilement, the girl it's a girl below 18.
Yeah.
Also getting to tell their parents or the people they stay with, it may be hard in the beginning.
Yes.
So even making an individual choice that I want to terminate this pregnancy for a girl who is below 18, it may not be that easy.
Yeah.
So access then becomes a very much issue. But there are also health consequences. Because now access is now hindered. You have stigma on the other hand.
Yeah.
Some women now decide to self-manage.
Yeah.
So you find a woman walks into a pharmacy, buys some misoprostol, which is the medicine that can help terminate.
Yes.
Then they go home and administer it. So most times without an indulgence of a healthcare worker, they don't know what side effects. They do not know when things go south, where should I run?
Yeah, and what
now,
to do.
They remain in pain. They remain victimized, emotionally disgraced. So that psychological torture plus the physical pain, that the trauma that they go through are all consequences of what we have around the law.
Yeah.
So there are also legal consequences because health workers have been remanded for aiding women to terminate a pregnancy or to terminate pregnancies. Some women have accused the health workers of aiding them to terminate pregnancy, yet they didn't want that.
Yes.
So now you see the laws that exist don't even say anything about health workers. So health workers are not protected at all.
Mentioned anywhere.
Now, even when a woman was maybe the one who under a condition, she would terminate a pregnancy.
Yes.
And she goes to this health worker and they help them out. They can flip the coin tomorrow. And they suggest that this was not, my interest was not to terminate a pregnancy.
Yes.
And because definitely there are records that indeed the pregnancy was terminated. It can be now a problem to the health worker.
Yes.
So health workers have been remanded. Women too have been remanded.
Yes.
Because their partners didn't agree.
Yes.
For this pregnancy terminated.
Yes.
Because their families were not supportive. So instead they go and legal battle them.
Yeah.
And at the end of the day, they are found guilty because they probably are terminated pregnancy. One, behind the law, because the law did not allow for that particular reason why they were terminating it. They were not, they would not qualify for any situation that as guided by the policy on abortion.
Yes.
So then definitely they're guilty.
They're guilty.
So so there are legal consequences, definitely. But I think, so again, those consequences cannot be handled independently.
Yes.
So if we want to improve the health of our people, we need to handle the entire issue in jointly or comprehensively. And that's one of the things I've argued out in some of the works I've written from the data I've gotten in the field of talking to people, talking to women and some health workers.
Yeah.
South Africa, for instance, of course, openly allows abortion.
Yeah.
But they are facing some of these problems of access.
Yes.
They are facing problems of consequences like health consequences. Women are struggling with self-managed abortions.
Yes.
Now, if that's one of the reasons for that is because they didn't handle the entire issue jointly or all together. Because even the stigma is high.
Yeah.
It's in South Africa. Some of the works that have been written by some scholars suggest that women have been subjugated to torture, like like verbal torture by health workers. Yeah, because a health worker doesn't agree that this woman should terminate a pregnancy.
Yeah.
But the law allows her, gives her that freedom.
Yeah.
And because the health worker doesn't agree, it's because of stigma. It's because of the moral stand. And now they talk to a woman as though they shouldn't get this care. They actually verbally torture them.
Yeah.
They even talk them out of the decision to terminate the pregnancy.
Yeah.
So that's all because the stigma was not addressed.
Yeah.
So if we think we can solve this, and it's just expanding the law, or even say allowing for abortion, does not work on stigma, does not work on the health consequences that can come out of that.
Yes.
Even the legal issues that we talked about, because at the end of the day, still you may find that some women or some health workers are not protected, maybe because the law just opened up for abortion, but did not have clauses that can help protect health workers and guide on when do health workers when can they execute their roles without hindering the rights or tomorrow finding themselves in legal battles with their clients.
Yes.
So that's why if you're going to the discussion of can we evaluate this policy, can we reframe, you need to be ready to talk about financing, and not financing of just the process of the policy formulation or re-evaluations and all that, or adjustments. No, ready to discuss financing of the service, of the care. Ready to discuss financing of sensitization. Yes. Because now stigma, you have to deal with that.
Yeah.
Outside the hospital, in hospitals, in schools, out schools, in society, in our communities, you need in families.
Yeah.
So you need to discuss financing of stigma, you need to discuss financing of the care.
Yes.
Pre, during, post-abortion. Because the quality of care women need is very, very important. Pre the abortion, even when they're just making the decision whether to terminate or to maintain the pregnancy, to keep the pregnancy term, they go through a lot. So psychological care is important there. Where can they get it? Yes. Who gives it to them? Then during the abortion, then after. Because again, the other issue, like countries that have, of course, we're also facing it, that because we access is limited here. Yeah. Women are doing it, they are self-managing, clandestinely, unsafely, and all that. But even in countries like South Africa, where it has been open, again, now they're finding problems of, they're accessing it fine, but again, the culture is heavy in South Africa. So what they do, traditional, tea healers or herbalists have made it a business. Now, they attract a lot of women, especially young women, and also because of the money, it's cheaper to go herbal, whereas in South Africa than attaining a medical abortion. So young women mostly have run to herbalists, especially those who get pregnant while young, 15, 16, and they don't even want families to know. Now, because again of the stigma, so they run to herbalists. And what happens? The pregnancy does not completely emerge out. So they get an incomplete abortion. So again, they may not know. Until 2 weeks later, they start having funny discharges.
The symptoms.
Getting pain. And maybe they can talk to someone, or they can later say, let me run to hospital and see what's wrong with me. But before that, someone can lose a life. Because given the nature of the timing, or even the impact of what the incomplete abortion caused, or even the abos, because some of these abos are unsolicited. They literally have not been agreed upon that they can actually help in terminating a pregnancy. So they are unsolicited, and women end up using them, and definitely the damage on their health is...
there's even more damage. Okay, I think we're going to take our 25-minute break and get back into it.
Welcome to the Parliament Performance Tracker Platform, a portal designed to empower Ugandan citizens with valuable insights into their parliament's performance and financial landscape. Some of the key highlights of this platform include the Parliament Legislators Report Card. Here, you find comprehensive information on the members of the Ugandan Parliament, from contact details and their biographies to their legislative performance, including bills sponsored, bill participation, term count, and the number of parliamentary committees they sit on. This section provides a transparent view on each legislator's contributions and activities. The Finance Tracker. This consists of two powerful tools, the Budget Tracker and the Debt Tracker. The budget tracker displays the current budget allocations of Uganda, allowing you to track how public resources are distributed across various sectors. But that's not all. There is also the budget simulator tool, enabling you to actively participate in the budgeting process by simulating your preferred resource allocations. While the debt tracker provides insights into Uganda's national debt standing, you discover key metrics such as the debt per citizen, GDP per capita, and per capita income, along with the sources of these loans. Stay informed about Uganda's financial health and the implications for future generations. Insights. This is a platform where you can gain valuable knowledge about parliament-related topics. Simply enter your queries and our system will fetch relevant articles and also provide AI-generated summaries, offering you a deeper understanding of the issues that matter to you. With its comprehensive tools, staying informed about Uganda's parliament and financial landscape has never been easier. Whether you're curious about your representative's performance, want to understand the budget allocations, or seek insights on parliament-related topics, this platform has you covered. Empower yourself with data and take an active role in shaping Uganda's future. Parliament Watch. Your eye on Parliament.
So in our society, we tend to shy away from certain topics, especially the adults and when they're speaking to the youth and even people younger than that.
Right.
So I was just wondering, is there a sort of sex education framework, or and if there is, what does that sex education framework look like in Uganda?
Right. So saying there is should mean that it's working, or it exists, and like we can borrow, what's in there and use it. But the right answer should be there is no. Though there were efforts, to have this for it had been worked out following the lines of our education system. From pre-primary to tertiary institutions.
Yes.
And had been launched in 2018 under the Ministry of Education and Gender. But it got a backlash, especially from the Interreligious Council, or call them religions, where most religious authorities suggested that it was not good to have such a framework in schools. And of course, they are a big stake in our education system. Like there are many schools under Islam, there are many schools under Catholics, there are many schools under Protestants. I think those three major religions in Uganda, they have established, though they have contributed to the education system, and definitely they are big stakeholders in the education system. So when they suggested that for them they would not be implementing it in their schools, it was a regress for Ministry of Education, but also Ministry of Gender, which was looking at improving the talk around sex, around sexual reproductive health, around sex and sexual behavior, and also to improve the knowledge that young people can have about sex, because these talks are happening, right, among young people. And when you happen to be part of them or hear them, you'd be shocked because they're happening ignorantly. So there's a lot of myths and misconceptions
around it.
Around it. And I think for me, the framework was going to be one of our biggest resources to streamline the conversations around sex and its outcomes among our young people. Such very that, we have a knowledgeable population. And people should be able to understand, or young people would be able to understand that this is the outcome if I engaged in sex, or these are the outcomes. You've had conversations in society of things like when you have sex in a swimming pool, you don't get pregnant, things like that. Or when you have sex and then go shower, get a shower quickly, you don't. But those are myths and misconceptions of young people. Some people, even adults actually, leave alone the ones who have not yet made 18.
Yeah.
Even adults who have been out of school. Some who even have some children already. I've tried to use the BID method of family planning. Yeah. Or call it the safe days. Yeah. And they have failed on it because they don't know how it works. They don't know which days are safe, which ones are unsafe. They do not know. Yeah. And these are things that actually a senior 6 vacist or a senior 6 graduate should be in the know about, because this is someone who's already dating. Yeah. So you can shy away from the fact that you can shy away suggesting that this information will disrupt the moral ground or the values we are instilling in children or in our young people. But they are doing these things behind your backs. They are dating, they are seeing each other. Some are even sexually active before they go to higher levels of learning, their institutions of learning. Some children are as active as early as 9. Not even say in far countries. We've done research in Kampala here. Yeah. And children are as active as early as 9. And some of them are actually active at 10, 11, 12, and they're actually active. They're having sex for money. Yeah. So if someone is 12 and they're having sex, we're making it worse for money. For money. Meaning that the exposure to several men or partners is high. Like there will be a high level of exposure to different multiple partners or multiple sex partners. Yeah. Which increases her risk of the outcomes. So does she know how to do it safely? Does she have the courage to ask whoever she's sleeping with to put on a condom? Does she have the courage to know that I can easily get pregnant? So let me avoid this unintended pregnancy, which at the end of the day now may lead to an abortion or seeking an abortion. Because when they get pregnant when they don't want, yes, they're having sex, but they don't want to get pregnant. So when they get pregnant when they don't want, they definitely want to terminate the pregnancy. Yeah. Do they even know where to go? To even if not to go to terminate, do they even know where to go talk to a knowledgeable person about their decision-making process of like, should I keep it or not keep it? Yeah. They don't even know. Yeah. Now, the sex education framework was for that, was meant for that. And it had age-appropriate information that for preschool, pre-primary, this is the content we want them to understand about sex and the body. For primary, this is the case. And lower primary and as well as upper primary, this is integrated. Lower secondary, upper secondary, university, tertiary institutions. Yeah. Now, all that, we missed it. Yeah. So I think for me, government and even non-government, I think for the civil society has done its work. It has tried its best to really call for efforts in having this framework implemented. But I think the biggest challenge now we have is our religious authorities. They need to wake up to the reality of what is going on in our societies. And then they should agree to have this implemented. If they are worried or if their worry or concern is on the content, then they should raise that, and then that can be adjusted. That can be adopted. Yes, but they shouldn't stand in the way for the sex education framework. Yeah, because there's a lot going on in this country. If a child gets pregnant at 9 or 10 for their second pregnancy, now what kind of thing is that? So you're saying you protect the moral ground of children, but they're getting second pregnancies at 10 years. Yeah. Go to Luka, Namayingo, Buvuma Highlands. This is what's happening. Even in Kampala, people are getting pregnant before 15. For the past over 20 years. Yeah. Yes, for the past over 20 years, our teenage pregnancy rate is that for every 100 girls who are below the age of 20, between 15 and 19 years, for every 100 girls, you'll find 25 of them who have had a pregnancy. Oh. So it has always been 24, 25, but that is the same number. Yeah, so there's no difference at all. Even with the improvement in say civil society has done a good job in trying to penetrate the high risk areas and trying to sensitize. Yeah. But even with that, the numbers have remained up.
Yeah.
So what should be done? I think these are the questions that should be asked religious authorities. Okay, if we do not implement, or if we don't want us to have the sex education framework, what should we have for these children to learn the right thing to do?
Yeah.
Because even the churches or the mosques who may impede or hinder the implementation of this framework, they have had no programs to help the country or the state to improve on the knowledge of uptake about sex and its outcomes among children or among young people. So I think for me, they should not just bury or block the framework. They should, if they block, then provide a solution, provide an alternative. Yeah. Because I think they should become aware that the problem exists. And if the problem exists, then there's need to do something.
Get to the
and
root.
What should that be? So if the government had thought, plus its government partners, if they had thought that a sex education framework is ideal, then you think it's not, then tell us what we should do. Yeah. So I think for me, it's we are late.
Yeah.
That's something we had implemented right away in 2018 when it had been launched. But over 6 years now, 7, we have failed to have any progress about it. And we continue to see the same outcomes in our community.
Based off of I think the harsh tones that we face in this society. Right. So you talked about the Penal Code Act being first enacted in 1950. Then you talked about an adjustment in 1995 and then 2006. So I was wondering, have you seen or studied any policy reform efforts, whether by civil society, health institutions, or within Parliament? And what do they look like? Basically, what next now that there's an issue there?
So specifically around abortion, there have been not that much done. Because it hasn't been a welcome topic in the legislative house. What civil society has done, and people who are working in the area who know what's going on, they have called for reforms. They have called for time to sit down and discuss this. In the State of Uganda Population Report of 2022, which we wrote then, we argued for this. We made a call for this. And if indeed authorities consider what we write, and I mean, this is not, for the State of Uganda Population Report, this is not even mine. It's now their product. It's their tool. So if actually they did consider even what they do for themselves, what they produce for themselves, they should really have thought about the next way forward around sexual reproductive health in general, but also abortion specifically, because yes, we are making efforts, we are making positive efforts around maternal health. We are still doing bad, because we are over 200 maternal deaths for every 100,000 live birth. That's we are still terrible, but numbers have been going down from about 336 7 years ago, 8 years ago. Which there's some progress. Our health centers are also making some tremendous progress, especially to have women give birth and not die while giving birth. But of course, with several challenges.
Definitely.
So the reforms are not even just for abortion alone. They need to go towards even financing sexual reproductive health in general. Of course, that means also looking into the financing of health in general. So already if money is not enough for health in general, then what about looking at specifically the elements of sexual reproductive health and maternal health? It definitely will be constrained. Now, for abortion, it doesn't we don't only need reforms around financing, but also the law, what the law says, what the policies say. But like I said earlier, to think about that, we need to be ready for conversations to comprehensively evaluate the legislative ground around abortion. Not to just have Parliament sit down and maybe say, okay, we are making more considerations of other situations or reasons why women can terminate, or how women should terminate their pregnancies, or how a couple should think about terminating their pregnancies. So we need to have a comprehensive evaluation on that. Because I predict more challenges if they just say, okay, women are asking for like more leeway, more openness, more freedom on why they should terminate the pregnancy. Okay, they can terminate, but nothing procured, to assist in termination.
Yeah.
When a woman moves into a health center 4 or 3, they cannot be facilitated, they cannot be helped. Now that will all be useless.
Yeah,
because now what's happening? You're sending women back to self-managed clandestine abortions.
Yeah.
Which, again, comes back to you, the state. Because this woman with an incomplete abortion, she's coming back to you for post-abortion care, which increases that budget, or increasing the risks of death as well.
Yeah.
But also the quality of life of a woman. So when a woman engages in abortions that are clandestine, not medically managed, they definitely the impacts of the complications, some of them last longer.
Yes.
You may not want to. You may think about only physical complications, but there's a psychological bit of it.
Yeah.
I've talked to some women, and they aborted when they were like 18 years, and today they are 40 years.
Yeah.
But they still
think about it.
Yeah, they still think about it. They still regret.
Yeah.
And it's because when they were making this decision, they did not have a place to go to sit down with someone who is professionally clear, knowledgeable, and talk about them or their decision to terminate this pregnancy or to end this pregnancy.
Yeah.
So when you're thinking about reforms, that all should be put into consideration.
Yeah.
And of course, they have been calls for all this. The question has stayed on whether the state or the government is willing, or the respective authorities are willing to sit down and make considerations of these calls.
Yeah.
Yeah.
Yeah. Definitely. That's a good one. So you mentioned the different roles that civil society plays, the health workers, and then also Parliament. And I was just wondering what kind of role can we play? Like the people. Yeah, the people that maybe don't know much about the legislature, like we haven't studied it. Yeah. We're not into civil society and health workers, like the people,
around the reforms.
Yes, around the reforms. Like,
I think people need to do about 2 or 3 things. I think the first, let alone the reforms, plus the reforms, because one of the things I was calling for was the implementation of the sex education framework, which was launched but now not working at all, because it was actually regressed, it was recalled. Yeah. Now, parents, communities need to come in and fill the void. There's a gap.
Yes.
Because schools are trying, but not every school, because every school has its own design. I think schools are more focused on their own curriculum.
Yes, definitely.
They are more focused on grades because they want to appear with the top grades in the country, and then they get more students, and definitely they make more money. Yeah. But some try to have these conversations. Yeah. They try to bring in people from outside the schools to talk to their students and all that. And of course, because it's not a regular, sometimes when you talk to students, school-going children, sometimes it's they are in a view of like, what you're talking, it's more of like we don't care and all that, we know what we are doing. Yeah. But there are people, there are those who pick out. Yeah. There are those who learn. Yeah. So you need to just increase the efforts. Yeah. 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 So communities need to take up that. Parents need to work on themselves. I don't think, and I have not, from my observations, even the parents I've talked to, they are not ready
to have the conversation.
To have these conversations with their children.
Definitely.
And children as early as 4, they are wondering where children come from. Yeah. So if you don't explain to them these things, for them they will keep having the questions, and they will keep wanting to see some answers. And in the process, that's where some problems may happen. Yeah. So for me, one, that they should take up that role. They should come in. They should not wait. Yeah. Then, the stigma. Now, that's the other part they can play. Yeah. They should learn to be more considerate, more accommodative. Because in some families, even if they add that you terminated a pregnancy, yes, they may... I am not for like people should terminate pregnancies as they want, but we need to understand that there is need. There is need to have those services. Or that you'll find at some point you'll find some girl or woman who is going that direction. Therefore, if it has happened, what do you do? So families, instead of like a child or a young woman has terminated a pregnancy. So instead of going against them, the question should be, what should we do? How can we be of support? Because you may think that you'll be hard onto them. Some of them end up being beaten, actually.
Yeah.
I've talked to them, and when their families got to know that they terminated their pregnancies, they ended up being physically assaulted.
Yeah.
Someone may call it discipline. But it's questionable.
As Africans, yeah.
It's questionable. So my issue would be, okay, these same people, the beatings they may get, some have been chased out from home. Some have not been looked at the same way. I've talked to a woman who left their home and she never returned because when they learned that she had terminated, they didn't beat her, they didn't chase her away, but they looked at her differently. They looked at her differently.
Side-eye.
Yeah. So that negative look on every time kind of like lowered her self-esteem to continue staying in their home, but also in the same village. So she decided to move. Now, such people sometimes have ended up getting pregnant again and end up in second abortions or repeat abortions, not even one or two. So the question would then be, if we had put this energy of physically getting into her or emotionally getting into her brains by lowering her self-esteem and not even being considerate of her, why didn't you sit her down, get to know why the challenge, why did she terminate, and then talk into the future, talk into how she can avoid these abortions, these unintended pregnancies. How can she do better in her life and her sex life? So I feel there may be need, there may be emotional trauma with the parents as well. Someone may feel disrespected because her daughter terminated a pregnancy. To avoid future terminations, I think you need now to bring the person closer than by pushing them away.
Sending them
So
away.
that's all because of stigma. Now, stigma for the society, plus even healthcare workers. I've heard of healthcare workers who have not heard, but talked to them. And they have told me how they have advised children or young women who were raped to not terminate those pregnancies. You get? Now, if this woman has come terminated pregnancy because they were raped, it's good to talking to them what's going to happen to them when they abort or in the process of abortion, because abortion is a medical procedure. But I think talking them out without considering their emotional health or well-being is somewhat far-fetched or wrong.
Wanting.
Because this is trauma they are dealing with. Unless it's the woman who has said, I'm going to keep this pregnancy. But a pregnancy out of rape is something that is questionable to keep. And even because they're not going to be with the father of this child, even if they knew them, because some even know the people who, the perpetrators.
The perpetrators.
You get. So where are you leaving this young woman with a child, no one to help assist her in parenting them, no one to assist her in financing the process of the pregnancy, but also after the pregnancy when the child is born. So that's why we need to do better as communities. Our stigma around abortion has to be checked. Has to be checked. Because like I said, even if we passed laws as open as our about abortion, when things like stigma not worked on, then it will be useless.
It will be useless, definitely. Charles, this has been an enriching and thought-provoking discussion. Your insights remind us that sexual and reproductive health, with the bias in abortion, isn't just a policy issue, but also you mentioned around stigma, where you even tapped on mental health. So it's not just that. Reproductive health. So it's a lived reality shaped by different systems. Before we end our discussions, do you have any parting shots?
Yeah, I think I'll raise 3 calls. So one to the religious council or the interreligious council, but also independent religions, like authorities, the Catholic administration, the Anglican administration, then the Pentecostals and the Muslim administration. I think it's high time they reconsidered their hindrance to the implementation of the sex education framework. If anything, I think they need to think about maybe the content and then provide their suggestions and thoughts around that. Otherwise, we need to really have this done. We need to have the implementation of the sex education framework because we do need it. There is a problem.
Yes.
Yeah. And 2 is government needs to start considering a clear policy around abortion. And of course, by abortion, it includes post-abortion care and all that.
Yeah.
But we need to think about a clear policy. We need to start thinking about a clear policy around that because our people are affected. The nature of care they get is affected by the ambiguity of the current runs regarding the legislation or the law and policy on abortion. So those considerations government should really think through. Should really start considering the calls that have been made, especially by civil society.
Yeah.
And these exist. They have access to them, but also the civil society that is really that has a speciality around sexual reproductive health exists. They're still around for conversation.
Yeah.
The community is around for conversation.
Yeah.
This may not be looked at as something of is this what the community needs in terms of like the attitudes around abortion. It should be looked at as I usually say that abortion care is health care. So by not considering the provision of such care, you are actually denying people their right to health care.
Yeah.
Though most people look at abortion as a filthy act, as something that's just done by people in society. No, but we need to start looking at abortion as health care. And we need to remind ourselves that by denying the women or the couples who choose to end a pregnancy for certain reasons, we are denying them their right to health care.
Yeah.
So if we move with that agenda, we shall be able to really make considerations fronting the health of the people, not fronting the morality of that comes with a pregnancy and keeping it to term, regardless of the outcomes of that pregnancy. And finally, the parents, they have absconded from their work, and it's time that they came back. Yeah. They talked to those young people. Then they also talked to each other, like as parents at home, talking to each other about the young people they have in the home and how they are going to be able to talk to them. If they cannot talk to them, then they need to find resources to talk to them, to get them the conversations. Yeah. Some of these happen or are available in some communities. They have youth centers where they can get appropriate information. Yeah. So it is a role of the parent to look for that resource and ensure and evaluate it and know that the nature of this resource is going to be helpful for my child. So if they cannot do it, then they need to look for someone who can do it.
Yeah, definitely. I like the call to action for parents, because a lot of the time in our society, as I said earlier, there's a certain trend of sweeping things under the rug, either thinking that people won't understand it or they're too young, but before you know it, they're 18 and actively. So Charles, this has been a rich and thought-provoking discussion.
Thank you.
Your insights remind us that sexual and reproductive health isn't just a policy issue. It's a lived reality shaped by different systems. You also talked about how it affects mental health. I don't think that's something that comes into people's minds a lot when they are talking about sexual and reproductive health, specifically with abortion in mind. Thank you so much for joining us on the Policy Digest.
Thank you.
We hope to see you again, because this is definitely part of a bigger conversation. And to the audience, thank you so much if you've made it this far. For more information on these topics and more, find us on YouTube, Podbean, X, or Twitter and TikTok as the Policy Digest. Thank you.
Thank you for listening to the Policy Digest podcast, the Center for Policy Analysis podcast that is profiling African ideas and people that are shaping the future of their communities. Subscribe to all our platforms on YouTube and Podbean.